Hi everyone. Today in this video let us discuss about side effects of Metformin. Metformin is one of the well-known drugs which is indicated for the management of type 2 diabetes mellitus. This drug chemically belongs to biguanides, which is the first drug that is going to be prescribed whenever the diabetes is recently recognized. Metformin can be given as tablet form as well as extended tablets, where an outer coat may be present which is going to release the drug in an extended way. So Metformin is available as immediate release tablet as well as extended release tablet. But what are the side effects produced by this Metformin? We have seen that Metformin is indicated for the management of diabetes, but it can also produce a diabetes as a side effects. But it is not the real diabetes. Here the side effects of Metformin can be remembered with a simple mnemonic: diabetes. Here every letter indicates one specific side effect related to Metformin. D can be remembered as diarrhea. So one of the important side effects of Metformin is the diarrhea, which is observed in many of the patients as this drug mainly produces gastrointestinal side effects. And the letter I can be remembered as indigestion. So indigestion is the second side effect produced by Metformin. And A indicates asthenia, lack of energy. B indicates bloating, it can increase the fullness of the stomach. E is the emesis, so Metformin can produce the nausea and vomiting. T is the taste changes, this drug can produce some taste disturbances. E is the eating changes, Metformin can produce some loss of appetite. And S can be remembered as sweating. In this way, the side effects of Metformin can be remembered with a simple mnemonic: diabetes. So today in this video we are going to see the side effects of Metformin, how they are going to be affected, and what are the long-term side effects produced by this drug. All these things we will discuss in this video. So the first one is the diarrhea. Metformin can produce some bowel changes, so it can produce diarrhea in the patients resulting in watery stools. Particularly this is observed with increased dose and frequency. And these watery stools can also produce some dehydration within the patients. This is particularly troublesome when this Metformin is indicated for long-term treatment. For instance, when this Metformin is used for more than 3 months, it can produce some significant diarrhea within the patients. The diarrhea produced in the patients may reduce the patient compliance, resulting in the withdrawal of its uses. That's why the diarrhea produced by Metformin should be carefully controlled. So in such patients, intake of fluids can be increased along with some rest, which reduce the symptoms of diarrhea. And sometimes Metformin can also produce opposite effect resulting in constipation. So either it can produce diarrhea or constipation because of changes in bowel movements. Diarrhea is a common side effect that can be observed in many of the patients, but in few of the patients, constipation can also be observed. Second side effect is the indigestion. Just we have seen that Metformin can produce the diarrhea. At the same time, this drug can also produce some abdominal pain and dyspepsia, which produce indigestion. Third one is the asthenia. The use of Metformin is to reduce the glucose levels. So this Metformin can produce some weakness in the patients. This drug can reduce the glucose levels by inhibiting the hepatic glucose production. The liver can produce a glucose which is going to be inhibited by Metformin. So because of this effect, Metformin can produce hypoglycemia, which may increase the weakness in the patients. And this hypoglycemia may also result in few of the symptoms such as dizziness, headache. So Metformin can produce all of these side effects due to asthenia, lack of energy, that is going to be produced by this drug. Fourth one is the bloating. Just we have seen that Metformin can affect the gastrointestinal system. So within the stomach, it can increase the appearance of gas bubbles. So these are the gas molecules produced by Metformin, which may result in the indigestion, as well as they can apply some pressure resulting in some abdominal distension, abdominal pain, and even it can produce abdominal fullness. All these symptoms are collectively observed with Metformin, which again increase the symptoms of indigestion. Fifth one is the emesis. Just like many of the drugs, Metformin can increase the feeling of emesis. So nausea and vomiting is one of the important side effects that can be observed with Metformin. In order to reduce the emesis and gastrointestinal side effects, this Metformin can be given along with the meals, and this can reduce some feeling of emesis, nausea and vomiting. If it is going to be taken on empty stomach, the severity of nausea and vomiting may be increased. So metformin should be taken along with the meals. Sixth one is the taste changes. Metformin is one of the drugs which can produce some taste changes resulting in metallic taste. So this results in the loss of taste and taste disturbances. Few of the drugs like metronidazole, which is an anti-amoebic agent, can also produce the metallic taste. Seventh one is the loss of appetite. With the use of metformin, the appetite is somewhat going to be reduced. So this loss of appetite results in the weight loss, which is somewhat beneficial in the patients with diabetes and obesity. But in the diabetic patients with normal body weight, this metformin can produce some weight loss due to loss of appetite. Eighth one is the sweating. So this side effect of metformin is rarely observed in few of the patients. This drug can produce some excessive sweating, increased heartbeat resulting in the palpitations, and vasodilatation resulting in the flushing, redness of the skin. All these side effects can be observed with this metformin in few of the patients. And it can also produce some flu-like symptoms. So these are the 8 types of side effects produced by metformin which can be remembered with simple mnemonic diabetes. Now let us see the long-term side effects produced by metformin. One of the long-term effect of metformin is on the lactic acid levels. Metformin can produce lactic acidosis, so the lactic acid levels may be increased greater than 5 millimoles per liter. In such conditions, it can affect many of the organs, particularly the muscles can be affected resulting in the myalgia, and it can also produce some hypotension, diarrhea, loss of appetite. All these side effects are observed with metformin due to formation of lactic acidosis. But this side effect is observed after several months of treatment, and whenever these symptoms are observed, then this drug should be carefully used. And this lactic acidosis can be increased with liver dysfunction, renal dysfunction, or recent surgery, radiological treatments, and many of the conditions may increase the lactic acidosis. So such factors should be considered when this metformin is prescribed for long-term treatment. Similarly, this drug can affect the vitamin B12 levels, so it can produce some vitamin B12 deficiency, which produce some anemia within the patients. So these are the various side effects of metformin which can be remembered with simple mnemonic diabetes. D indicates diarrhea, which is one of the important side effects. I indicates indigestion. A is the asthenia. B can be remembered as bloating. E as emesis. T as taste changes. And E and S are eating changes and sweating that are produced by metformin. Apart from these side effects, metformin can also produce long-term side effects such as lactic acidosis and anemia due to vitamin B12 deficiency. So that's about the side effects of metformin. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.